Something you may have come across in the news is how rural hospitals across the country have been closing and that more are expected to shutter as a result of funding cuts at the federal level. And yet, with ECU Health's large footprint in rural Greenville, North Carolina, where East Carolina University has a medical school, you would think access to health care is no problem for the people who live here.
That would make the logical assumption. According to the North Carolina Center for Health Statistics and the Pitt County Health Needs Assessment Report, Pitt County has 195 primary care health providers per 100,000 population, which is better than the state at 101 per 100,000 and the U.S. at 112 per 100,000. It sounds wonderful if you just look at those numbers. But what you have to consider is that the access to care is more than just the number of providers. It really is the timeliness from the time that the patient calls to make the appointment to the time that the patient actually is able to access that healthcare service. So we have a huge discrepancy when we look at access to healthcare, when you look at it in that area. That's an area of what we call quality healthcare, and access to care is one of them. That delay can be months for primary care and a little longer for specialists. So while we have enough healthcare providers or a large number of healthcare providers per capita, it is still not enough. And projections for future levels of healthcare providers per population base is not looking good on the horizon. There's actually an expected decline, particularly in nursing, over the next decade and beyond. So there's more to consider just than the number of healthcare providers. And I'll just say one of the things that we can do as a community is to make sure that when we have a doctor's appointment, we put it on our calendars and we protect that time that we've made that appointment for. And if we see that we cannot keep the appointment, to call and cancel that appointment. And I look at it this way, having been a public health nursing administrator and actually being on the side of healthcare, that I needed healthcare and couldn't get in for 7 months to get into a primary care provider. When you don't keep your appointment, there are two people not being seen. You're not being seen, and the person who could have had your slot, your appointment slot, is not being seen. So it's more than just about me as an individual getting healthcare access. I'm really blocking another person from getting in to see the doctor.